Good morning. I'm here with Sara van Koningsveld. Is that right?
Yes. Yep.
And she is the founder and president of Whole You Health. And we're here to talk about dance therapy and some of the holistic modalities that she uses to treat her clients. Good morning.
Good morning. Thank you for having me.
No problem. So, why don't we start out with what led you to pursue a certification as a dance therapist?
Sure. Um, I'll try to do the abbreviated version because as with, I think, most of helping professions, there's the long version as well. Uh, the short version would be that I grew up dancing, and through many of the struggles and challenges of my own life and development, dance became my therapy. It became my therapeutic outlet. Um, to the point where, I did competitive dance and everything, but when I went to pursue my bachelor's, I chose to pursue a bachelor's in dance. And meeting in maybe my second year of university, my academic advisor was like, "What are you going to do? Like, what do you want to do with this degree?" And in talking with her, and about my interests and what dance has meant to me. And this was like the early 2000s. She just said to me, "Have you heard of this thing called dance therapy?" Just knowing, yeah, knowing a bit of my story and how I was doing in academia. I was at a public university, so I couldn't just focus on the art. I had to do, the universal studies of the
Mhm.
sciences and English and everything. Um, but I hadn't. And, fortunately, we were on a little bit higher speed internet, but, the internet wasn't as vast and broad as it is now. But she sent me to the rudimentary web page for the American Dance Therapy Association,
Wow.
and encouraged me to just read more about it and look more into it and to better understand. And there is actually the American Journal of Dance Therapy, so I
Oh,
even started to look at a little bit of like the research that had been done in the field and how movement has been used, you know, really throughout history, but as far as research, science, and a professional practice since about the 50, like 40s, 50s after World War II, it really began as a profession in the hospitals with veterans.
wow.
Yeah.
I didn't know that.
Yeah, so our organization was established in the 1960s after about 10 or 15 years of people doing these things independently. They're like, we should create something more codified. So, yeah, that's really where it began, which then meant I pursued studies in psychology and basically I didn't earn a minor in psychology. It was wrapped into my dance degree. So my formal bachelor's title is a Bachelor of Fine Arts in Dance Studies, emphasis in psychology.
Oh, okay.
So I had about 24 credit hours, which would have been a minor, but it was lumped into my bachelor's studies. And
Ah,
part of that, I also, Arizona State being a large university, I was able to take intro to art therapy, intro to music therapy, intro to
mm.
dance therapy, just like, the 101, 200 level classes where they tell you about how these fields of the arts and psychotherapy really work. And I fell in love.
That's great. Yeah, I've heard it referred to dance therapy and art therapy as expressive arts therapy. Um,
Yes. Yeah, there's kind of two categories, I guess. Like there's the expressive arts, which really looks at them as an integrative use of art and expressivity. And then um, independently, they form the creative arts umbrella. So each, like if you're using just art therapy, music therapy, dance therapy, like they are seen as independent, requiring different certifications. And so there's actually a national coalition of creative arts therapies for all
wow.
of the art therapy, music, dance therapy, drama therapy, like boards, they meet and they discuss like advocacy and accessibility to our fields,
Oh, that's good.
like
I'm sure
collaborative.
you get your share of flack from people who don't really understand or appreciate
Absolutely.
it.
Yeah, yeah. But I didn't directly go into grad school. I actually took 2 years to work professionally. But after about a year and a half, I started to have like that inner like discontentment and doing some more deep reflection. And I was like, why am I working in an office? Why am I like giving up um, the thing that I love so much, like which is moving and dancing? And so yeah, I circled back about 2 years later and pursued my master's. And what was really unique is the master's program that I had chosen was a hybrid in both the creative art and expressive arts of dance psychotherapy, but also the clinical practice. So I studied in Illinois, which made me eligible to become, in Illinois, it's an LCPC, in California, it's an LPCC, so the
Ah,
licensed counselor. Yeah,
that's great.
yeah.
So you have a rich um, and broad array of experience there.
Yeah, yeah. I think it's one thing to learn the tools of such a specialized field, and I really can see the benefits as my career has progressed and having the clinical skills and the clinical language to have conversations like this, or even in the workplace, like articulating what it is I'm doing and why I'm doing it, even if I'm using the body in the work.
Ah, and speaking of which, how does dance and movement therapy specifically address trauma stored in the body?
Um, So I'll start on a random little tangent of what most people don't know. So Stephen Porges, the
Hmm.
innovator of
Olivia.
polyvagal theory,
Mhm.
yeah, he's actually a dance therapist. He actually studied dance
Oh,
therapy, well, I believe while he was working on his dissertation or shortly thereafter, as he was expanding this concept of polyvagal, he's like, I need to know more about the body. And so he actually studied, I don't know that he maintains his credential, but he did study dance therapy. He's actually going to be our keynote at the American Dance Therapy Conference, with another colleague, like facilitating a discussion on polyvagal and movement. Um, because, working with um, trauma in our field, and I'll speak more specifically to my work. We know that the brain and the body are connected. We know that we can't really like just cut it off at the neck, right?
hmm.
Um, but recognizing this bidirectional communication that polyvagal theory talks so much about is just um, the foundation of the work. Um, so when using dance movement therapy, often we're using the movement to access the felt sense in the body,
Hmm.
but also when we think of like primal brain and lack of access to vocabulary or that, prefrontal cortex, intellectual, visual kind of um, memory, we need to go into the felt sense of the trauma, right?
Uh-huh.
And so the movement and the body is then used to explore that felt sense. And so in some ways, the language of dance movement therapy in practice is similar to like ex somatic experiencing or
Ah,
somatic psychotherapy.
hmm.
Like, what are the sensations you're having in the body? Where do they live in the body? Do they move in the body? And then facilitating from those places. And it's not always about, unlike, somatic experiencing and other practices that may use language more often. Um, I like to say, or at least how I can summarize it, is that a dance therapy session focused on trauma in the body is about just being in it. It's
Ah,
about feel, like so as the questions are maybe being asked or the space is being held for noticing
hmm.
that you're then creating the space to let that express outward. It's not necessarily about, and there's different practices to it, whether it's more psychodynamic or, Jungian in concept or more modern and CBT in approach. Um, at the core, the dance therapy is about tapping into that and allowing it to come out. And so for
Ah,
me, I feel like it's almost like a narrative therapy but with the body,
ah,
right? Like, what's your
interesting.
story? Like,
Uh-huh.
how are you going to share that story with us or with me as your clinician?
Hmm.
Um, I've done group work too, so sometimes it is about sharing in community, but it can be subtle. It's not really instructive. There can be guidance or language, but at its core and at its core in the work, it's about allowing the client to tap into the experience in the body and sharing that, you know, um, felt sense, that stored memory, that unconscious or subconscious experience through through expressive movement of any kind.
Okay, and so then the idea is that once they've expressed it, it's no longer stored in the body. So are they free of that or?
So it can be progressive, and there's
Mhm,
actually a couple different ways again to work with it. Like everyone has their different approach, but in my practice, at least it's not about telling the whole narrative all at once. It's not about understanding it all the first time.
mhm,
You maybe just are tapping into one part of it at a time. And I don't want to compare it to exposure therapy, but in some ways it is kind of that gradual process of like gaining a sense of understanding, a sense of self-control, self-regulation. Again, thinking about polyvagal and down regulating or up regulating, but getting back in your window of tolerance,
mhm,
right? So it's as a facilitator, it's about creating that container. Like, where is the client at? How much can they hold that day? How far do
uh,
we go? And some of the facilitation or one approach I might take is to move with the client in a way of like mirroring so
uh-huh,
that they have a reflection of what's going on. Another approach might be to work with one of the words we'll use is like modulating or expanding. So I'm also a certified movement specialist in the theory called Laban-Bartenieff movement studies, and in that theory, it we can um, we use the language of movement repertoire. Everyone has a repertoire. Everyone has what's accessible to them. But by modulating a client, by introducing them to slight changes in their body, you're expanding their movement repertoire. Again, like going back, right? We're expanding the window of tolerance by
uh-huh,
like introducing slight changes in maybe the way they're moving, how they're moving, what they're moving, you know, um, and not through force and not by like expecting someone to go from a really contained, controlled small space to a really big space. Like that would be
ah,
too much, right? So
yeah,
how do we get someone who's maybe really in their shell, metaphorically, to
mhm,
gradually start poking out, right? Or creating a
ah,
little bit more. And all of that is an expansion of the movement repertoire.
oh, that makes sense. So you really have to be attuned and read the body and
Yeah.
their facial expressions. And I
Yeah.
guess, are they, like if they say, well, I've had enough for today, this is just too much, I'm assuming
Yeah.
you stop and,
Yeah, and noticing things similar to like any psychotherapy practice, noticing when there's shutdown happening, notice when there's dysregulation, notice if dissociating starts to happen, right? Like, and those things in the body can be really subtle. And so to your point, yes, it's a lot of observation. It's a lot of sensory and somatic attunement,
uh,
that we really, and that's where mirroring can be really helpful to start, is because if I'm mirroring with my client, I get a feel for what's in their repertoire. I get a feel for how they express themselves, big or small,
mhm,
and everywhere in between. and noticing what they're comfortable with, noticing, like if we were sometimes let's say hypothetically a new client, we do mirroring.
Mhm.
I might start by mirroring them and then they mirror me and then I get to see like what's too much because if they try to mirror what I'm doing and they're not able to do it, then I'm more informed of like where that limit is.
Ah, okay. That's
But in
good.
like the introduction would be more of a playful. It's not like we jump straight into trauma, right? It's like
Yeah.
let's like wave our hands and do a little dance, right? And just get them comfortable with being in the body and moving.
Yeah, yeah, it seems like a lot of people live up in their heads and
Yeah,
it's much more comfortable. And that's what we're rewarded for in this society. So
absolutely.
getting even just an awareness of the body is probably progress for a lot of people.
Absolutely.
Mm.
Yeah.
Okay. So how do you assess when movement therapy is appropriate for a client's journey, whether it's trauma or maybe anxiety or depression? Like what do you look for in that?
Yeah. What's interesting is, at least in private practice, most people find me.
Ah, right.
They're like, I see you're a movement therapist. I need to do more with my body. Like, my body is feeling disconnected. And so, it's amazing to have those clients with that type of insight. It doesn't mean they're connected to their body, but they're at least recognizing that there's the disconnection, right? Or where they're at in that journey. But as far as like assessing someone independently, I think um, there's this, uh, again, to your point, like this cultural thing of us needing to be in our heads all the time in order to be like functioning in society and like meeting the mainstream of like expectations and norms and yet we all are movers.
Hmm.
We walk, we shake hands, we nod, like there's always something happening somatically in our bodies. So there isn't a person that couldn't benefit from dance therapy. It's just how they might benefit,
Ah,
right?
yeah.
What they're needing. So regardless of the clients that like walk into services with me, I'm mostly on telehealth now, so I can't say walk into the room. But regardless of the client, it's about I think going back to that idea of adapting to where they're at and what they need. I've had, retired professional dancers, and I've also had people who work in offices. And it's like, at what level do they have a language and an understanding of their body, or at what level um, are they needing the body to feel reconnected with themselves or to feel that they have, the tools they need to stay regulated, to move into the world, whether it's to your point, whether it's anxiety or trauma.
Mhm.
Um, so sometimes it's a breathing activity, which most therapists use at some
Yes.
point or another.
Uh-huh.
But maybe the way I language it or maybe the way I facilitate it has hints of the movement therapy in it, just because I'm coming from that um, bottom up kind of lens more often than not, top versus top down.
Yeah.
And so, yeah, like my former dancers, we would have, even on telehealth, they just had their little space set up in their living room or whatever, and we would have full dance therapy sessions,
Wow.
like where they're just moving for 20 to 30 minutes, no words. Maybe I'm facilitating some guidance.
Mhm.
But in general, it's them expressing, and then I have other clients where it's just maybe 5 minutes, and then we talk about the somatic experience of it. So I don't think there's really yeah, I don't think there's a client that couldn't benefit from it. So in assessing whether they're eligible or it would benefit them, I actually don't think from that lens. I'm like, it's gonna come into my work. It's part of my work. And I never um, shy away from that part of my identity. And I always I do like to be very client-centered. So I always offer it as an invitation for those that maybe aren't movers. Like, I'd like to
Oh,
try this thing. Do you think you're open to it?
uh-huh.
And make sure that they also feel ready.
Yeah, that makes sense.
Yeah.
Um, so do you work with people with, maybe chronic pain or limited mobility, maybe someone in a wheelchair or someone who's rheumatoid arthritis or things like that?
Yeah. I actually do have a client with multiple autoimmune illnesses at this point and trauma. And
Hmm.
so we're actually part of our work is looking at how those coexist
Hmm.
because, she is able to recognize how she has flare-ups when her trauma response and stress is higher.
Yeah.
And so we're working on specifically like staying regulated, staying calm, creating healthy ways and places to move even when there is pain so that her nervous system, her autoimmune system can recognize and take care of itself.
Hmm.
Um, but I will say there are dance therapists that work in so many different capacities. One of my professors worked in a rehabilitation center and did movement in the pool. She did aquatic
Oh,
movement
that's a good
for
idea.
those with limited mobility and
Hmm.
or, needing physical aids and assistance. Like in the pool, you're more buoyant, you don't have
Yeah.
gravity, and so they're able to participate and find those ways to move their body and even build strength. Their physical therapists have them in the pool for that purpose, and then she would give them that therapeutic expressive opportunity in the pool as well.
Oh, that's really good.
Yeah.
Mm.
Yeah. There's
Okay.
I did spend about 6 months working in a subacute clinic that was adults, and so many of our clients were elder adults dealing with early dementia and Alzheimer's, and so some of them also with the physical limitations. And I will just say it was one of the most lovely experiences I had in contrast to all of my experience with children and families. To just turn on some music and see their brains light up with those memories
Right.
and then they wanted to dance even in their wheelchair. And I'd be like, all right, we're gonna go up and we're gonna go down. And it's not about being able to like stand up and reach up, right? It's
Mhm.
just about them reconnecting to that experience in their
Mm.
body as well as the memory of the music and their life, right?
Yeah, yeah, it's
Yeah.
amazing what music and movement can do in the brain.
Yeah. Yeah. There's some great dance therapists that do that as their career work, and I admire them so much. Not my field of choice, but I am
Mhm.
grateful that I had the opportunity.
Yeah. Oh, I'm glad you had that too. So, what physical manifestations of trauma do you commonly observe, and how does dance or movement address them? I guess we kind of covered some of that, but
Yeah, I'm happy to talk a little bit about it. And I think there are different approaches to like movement observation and kind of that assessment piece, where we would be looking at how trauma is presenting itself. Again, I come from the Laban Bartenieff school, and many of the US schools base their movement observation on that theory. So many of us are trained that way, but I just want to acknowledge that there are various approaches, not just Laban Bartenieff.
mhm,
But from the Laban Bartenieff um, observation lens, you know, we're looking at patterns in like the quality of the movement and the shapes of the body, as well as the way a person interacts with the space around them. So, are they contracted and small? Are they held and rigid? These would be patterns that we'd commonly see with someone that's maybe in a freeze response, right? That they're
ah,
just kind of down and
shut
stuck
down.
and yeah, that shutdown. There's no, they don't have the ability to really mobilize. Whereas if we saw someone that was in hyper arousal, right? Like we might see something really frenetic and fast and out of
Mhm,
control, or even really like physically aggressive. Not that they're actually hurting anyone, but just like in their fight
mhm,
response. There's a tension to that and a frenetic energy to that. And so we're using language that, even as therapists, we could have a common understanding of, but we're looking for it in the body. We're looking for what is their pattern? Where do they tend to live? And so most people tend to have more of that hyperarousal response or hypoarousal response, or they're bouncing between the two, right?
right.
And so then it's figuring out, well, where's their baseline when they're regulated? right? And so what we would look for then in the body is, are there moments where they recuperate in a baseline? And what does that look like compared to that hyperarousal or hypoarousal response in the body? And
Ah,
so it's not like a one size fits all. Each of us, I mean, my thesis was actually on Jungian personality typing and movement patterns. So like this is kind of one of my favorite topics. Um, but yeah, we all have a fingerprint. We all have similar to like looking at a Myers-Briggs, which I know is an evolution of Jung's work, but like looking at like personality types, looking at that fingerprint of what makes someone who they are. We also have a movement profile. We also have a way we are in the
oh,
world.
right.
And so it's taking that same idea, but putting it on the body. And that's how you're assessing how the trauma is being experienced or how the trauma is presenting itself. Like, are they avoiding it and shutting it down and it's creating this tension because it's somewhere over there and they don't want to deal with it, right?
Hmm.
Or are they just so chaotic that they, are, whether it's dissociation or heightened anxiety and like hyperarousal response and easily overstimulated, right? And then you're gonna see that pattern, you're gonna see kind of that fingerprint of their need, of their trauma. Yeah.
Mm. Yeah. So I guess for someone who's hyper activated, you would want more containment,
Yep.
and the
Yeah.
opposite for people who are shut down, you want more
R-
activation.
Right. And so that's where the modulation. So although I'll assess where they're at, right?
Hmm.
Like assess where the trauma is starting from. Are they in, that hyperarousal, hypoarousal, or are they fluctuating a lot and just like a roller coaster?
Hmm.
And then trying to get them back into that window of tolerance, right? Using modulation, like slowly introducing. Someone in hyperarousal does really well with breathing activities that slow them down, whereas someone in hypoarousal does better with, small movement that may include breathing to help them build more energy and space, and less stuck, frozen, shut down.
Ah, that makes sense. Yeah.
And it's incremental. It's like never rush it because what you're going to do is, right, throw them back into the
Ah,
response.
yes,
It's like the re-traumatization.
exactly. Yeah. The same as talking about trauma that happened to them without the coping skills and the
Exactly. Yep.
framework to, okay.
Yep. So
All
there's like
right.
there is and this is where there's that clinical parallel, right? Like, and
Mhm.
I that again why I love that I got the clinical knowledge as well as the movement is I'm able to not only see it in the body, but I'm able to also verbalize it clinically,
Mhm.
right? And so like recognizing when they're ready,
Mhm.
recognizing when they have enough of those coping skills and affect, awareness to be able to tolerate a little bit
Yeah.
more.
Yeah, that makes a lot of sense.
Yeah,
Okay. How do you handle moments when clients become triggered, or does that happen? Because like maybe something is stored in the body, like Bessel van der Kolk says, and
absolutely.
and they make a movement and it reminds them of a trauma, and then they're hyperactivated. I guess
Yeah.
what do you do then?
Yeah, and this is where like similar to using again, I worked with children and family, but like using like a TFCBT model, it's like you need to make sure that they have the regulating skills and the affect awareness before you actually are going too deep into some of those places, or that you have the rapport for the containment. Um, and like any practice, some people, sometimes it goes a little bit faster than maybe the client is ready for or that we were able to assess. But in those moments, it is about coming back to the regulation, coming back to the safe movement, coming back to presence in the body. So helping the client to tap into their breath, tap into grounding. It might be, depending on the situation, it might be finding a way to get the client to pause, to stop, to,
Ah,
whether it's sit down, lay down, self-touch, something that just really is recentering,
Hmm.
especially if it's goes into a hyper arousal. If it's hypoarousal, again, it's about bringing the awareness out of that stuck frozen place, right? And so maybe it's using, I like to use in those situations more of like the sensory mindfulness practices, like the five senses, or, just even having them focus on one specific thing. Like, can you describe, I don't know, the ceiling fan because they're
Uh-huh.
laying down, right? Like, what's the ceiling fan look like? Um, yeah, it's like even questioning or asking them, especially in the shutdown, like, what are you noticing right now? What are you able to focus on right now? Maybe it's my shoes,
Hmm.
and it's like, okay, fine. Like, what do you notice about my shoes, right? But helping them to find what they can orient to without like forcing something. Again, because a lot of um, being trauma informed is about also allowing them to take the lead. It's, less instructive.
Right, right.
Yeah.
Yeah, and it also honors where they are
Yeah.
in that moment.
Yeah.
Okay. Okay. And how can dance or movement theory complement traditional talk therapy for trauma recovery?
Um, so I will just say in like clinics and particularly like hospital settings, I just want to acknowledge that in California, there's often a recreation or complementary therapy kind of department or program where arts and including dance therapy may be included, arts, play, drama, music.
Mhm.
And so they're getting it as a supplement or an add-on to their traditional therapies and psychiatry and things. But independent of that, I think um, it gives the opportunity for the client to not have to over intellectualize something that is maybe already over intellectualized or labeled in different ways for them. I think it's often even hard and it depends on the age of the client, right? Developmentally, children don't have words for many of the things that have happened to them.
That's
But
true.
even, yeah, and so movement and play and art making, right, are great ways for them to tap into the experience of what has happened to them.
Mhm.
But I would say the same goes for adults. Like it's, not all, some of us have done the work to be able to have the ability to articulate our experiences, thoughts, feelings, etc. But we don't always necessarily have that clear memory of the trauma or what's happened to us. And so in that way, the movement can complement or enhance the traditional talk therapy by giving experiences that can then have words, right? And it can
Yeah,
be a layer to learning about feelings identification, and body experience and somatic identification. Like, um, I'm just thinking about a client that didn't know how to describe their pain until we were able to like visualize it, using visualization, but also
mhm.
layering the somatic, right? They were able to visualize the pain in their body, which then allowed them to have words for that visualization. And then they took the words and the somatic, like the internal sensory experience, and were able to move that, right? And
Ah,
it took that like multi-layered approach to get them there. And in that way, again, it complements, it enhances, it adds on to what, traditional talk therapy offers, right?
yes. Yeah, I noticed that more like residential programs for drug and alcohol abuse recovery and for, severe mental illness or crises are incorporating more
Yep.
movement into their
Yeah.
programs as well.
Yeah. Yeah. I mean, I've been in California about 15 years now, and I will say I really haven't seen a program that doesn't have it in some way. It's just what they're offering. Some of them might only have like yoga therapy
Hmm.
or like aquatic therapy or equine therapy, but all of those have a somatic experience to them.
Right.
And I think dance movement therapy as a field is just it's less well known. And that's on our fields, that's part of our responsibility in our field is to have interviews like this or put
Uh,
ourselves out there and to have the language. I think often it's a language thing, right? Like if we're completely in the creative process, we don't always have the words to articulate what we're doing and how it actually works.
that makes sense. Yeah.
Yeah.
Well, I'm glad that we're doing this.
Yeah.
So my last question is, what distinguishes therapeutic movement practices from conventional dance or exercise classes when working with trauma survivors?
Uh, at the core, it's the intentionality, it's the approach. Movement innately is healing, period. So I will never say don't exercise, don't do yoga,
Mhm.
don't, like they have value, right? The treatment facilities that have yoga, that have aquatic, that have equine, like they're all added benefit and they all have their different way of tapping into that somatic. But what makes dance therapy and what distinguishes dance movement therapy from those is the intentionality of really helping to have that bottom down or bottom up experience,
Mhm.
right? That you're able to take what's going on in the body somatically and it being expressed in the movement to create the ability to process it, to have the prefrontal cortex integrate it on a level,
Mhm.
right? And to be able to articulate it and I always remind my clients that even if you're feeling the trauma, it's not about being able to see or remember exactly everything that happened, but it's about being able to express and integrate what happened in a way that works for you, right? To
Ah,
find the acceptance, to find the healing, to find the forgiveness, to release the resentment, whatever the case might be, right? Whatever's being held in the body as it relates to those emotions. They might not even have the word resentment available, but as they move it, they're able to start recognizing, I'm holding on to resentment,
ah,
and
yeah,
then move
that's
from that
very,
place.
yeah,
Yeah.
that's very beautiful. Um, so where are you located, in this big state of ours? Or is it, do you mostly do telehealth or?
Yeah, yeah. So I am based in Los Angeles,
Mhm.
but my practice is telehealth. I don't have a physical office at this time.
Mhm.
Um, I I'm in private practice. I do work as a consultant in supervision and like program development for small organizations as as therapists are building their practice. I've spent a lot of years randomly in quality assurance, documentation, HIPAA compliance. So I consult from that capacity, but I also offer clinical supervision. So my work is kind of divided. My private practice is actually really small. I do have one associate under me who also
Oh,
uses somatic healing. She's an expressive arts therapist. That's her master's degree. So, not a specialty in dance, but really the broad stroke of using the arts in healing.
mm,
And she's also like a 20-year yogi. So, like, there's this spiritual mindfulness element in her expressive healing. So, I guess I'll promote her work a little bit. She's accepting clients under me. I currently have a full caseload. Um,
what's her name?
Her name is Lexi Traub, or she goes
Trump.
by Lexi Faith.
Okay.
Yeah, yeah. I'm happy to share that with you. And she is listed on my website as my associate.
Okay.
Um, but yeah, I do telehealth across California. I'm also licensed in Utah and Wisconsin, and I'm considering additional states at this point because I've had a couple people reach out, and I would love to be able to support where I can, and that's just how it works in our field, right?
Yeah.
Um, I offer training and workshops as part of my kind of consultation business. So I just did a training for KIP up in Marin, um, the
Yeah.
Community Institute of Psychology, I believe. Oh my
Oh.
gosh, don't quote me on that. Um, I just they refer to themselves as KIP, and now it's not in my brain. Um, yeah, and I did a 3 week on the mind, body, and trauma with them. It was like 6 hours over 3 weeks. Yeah, so I enjoy also doing offering my knowledge in that way of how do we make the body accessible even if we're not trained as dance therapists, right?
Ah,
Like how
yes.
to beyond just reading, the Pocket Guide to Polyvagal Theory or like taking a mini workshop, like how can you actually put it into practice?
Great.
Yeah. So,
Well, is there anything else you think we should know about you or about dance movement therapy or
trying to think. Something might come up as we get off, but
okay.
um um I would just say, like there's so much movement happening in our field. I guess that's kind of a pun, but like there's a shift happening in our field with the evolution of things like polyvagal theory, with the research of the mind body under Bessel van der Kolk, and others, right?
Hmm.
Like we have um, Pierre Levine, we have Stephen Porges, like they're all doing something,
Hmm.
and it's really grown this part of our field of psychotherapy. Um, and to just recognize that there's also like really that dance therapy as a part of that growth is a creative part of that growth. But
Mm.
it's wonderful to have practical like mindfulness and practical like tools and techniques and all of us, I believe, are creative beings when given the opportunity,
Ah,
right? That we
yes.
all have the ability to express ourselves. Movement might not be for everyone. Some people might prefer ceramics and working with
Hmm.
clay or drawing or creating rhythms and music, right? Or telling a story through a dramatic experience or poetry. I'm not going to exclude any of the arts therapies, but um, I think that that's where it kind of gets lost is that or forgot. I don't want to even say forgot about, but it's just not always included or recognized, right?
Right.
Is that movement therapy is a part of this evolution in our field, and what it offers is the creative element of that somatic experience.
Okay. I think that's a good place to end, and I so
Yeah,
appreciate your time and your
yeah,
wisdom and your experience. And thank
yeah.
you so much. And I'll put your, uh, I'm gonna stop recording here.